Welcome to the Financial Frontline. Today, we're tackling a question that will really define the next decade for millions of American families.
Okay.
You get a call that your mom or dad needs round-the-clock care starting tomorrow. How are you going to pay for it in 2026?
It's a question that keeps so many of us up at night, Alex.
Yeah.
And the brutal reality is, most of us are completely unprepared for the answer.
Mm,
The costs are simply staggering.
they truly are. Let's put some real numbers on this because this isn't some far-off problem.
Right.
Based on current trends, by 2026, the average cost for a semi-private room in a nursing home will be well over $111,000 a year.
Wow.
Want a private room? That'll be closer to $128,000.
And that's just for a nursing home.
Right.
Many people hope to keep their parents at home, but even it's incredibly expensive.
Yeah.
A home health aide is projected to cost over $70,000 a year. We're talking about costs that can easily surpass a middle-class salary.
Which brings us to a crucial point, this massive gap between perception and reality.
Okay.
A recent study showed that a staggering 80% of working Americans believe these costs are less than $100,000 a year.
Wow.
Even worse, the most common guess was somewhere around 25,000.
It's a multi-thousand-dollar blind spot. So if the costs are that high, how will most people actually pay?
Hmm.
This is where we need to debunk the biggest myth in elder care. Alex, what's the first thing people assume will cover these costs?
Without a doubt, it's Medicare.
Right.
The thinking is, my parents are over 65, they paid into the system their whole lives, Medicare will take care of it.
Yeah.
But that is dangerously incorrect. Medicare does not pay for long-term custodial care, the day-to-day help with bathing, dressing, and living.
It's a critical distinction.
Yes.
Medicare might cover a short, limited stay in a skilled nursing facility up to 100 days, but only after a qualifying hospital visit.
Right.
It was never designed to be a long-term solution.
Exactly. So if Medicare is out, what's next? Most people logically turn to their parents' savings.
Mm-hmm.
This is the number one way care is funded initially, out of pocket.
Okay.
It's retirement accounts, 401ks, the sale of the family home. It's every single dollar they worked their lives to save.
And when that runs out, which it does with terrifying speed, the financial burden shifts directly to the adult children.
Right.
We're seeing a crisis within a crisis for the sandwich generation. On average, family caregivers are spending over $7,200 of their own money annually. One study found it consumes up to 26% of their personal income.
Think about that choice. Do you use the money you saved for your child's college to pay for your dad's in-home aid?
Wow.
Do you halt your own retirement contributions? 56% of caregivers report cutting back on their own family's food and clothing just to manage.
It's an unsustainable model, a house of cards.
Right.
And when that house collapses, there's only one safety net left: Medicaid. But getting there is a painful, often humiliating process.
It is. To qualify for Medicaid, your parents have to be nearly destitute.
Right.
It's called the spend down, and it means they must exhaust almost all of their life's assets, savings, investments, down to a state-mandated level, often just $2,000.
Unbelievable.
You essentially have to erase a lifetime of financial security just to get help.
And what about private long-term care insurance?
Yeah.
We hear about that as a solution.
It's a solution for a very, very small few.
Okay.
It's become incredibly expensive and just difficult to qualify for. The data shows only about 3 to 4% of Americans over 50 have a policy.
So not many.
For the vast majority of families facing this in 2026, it just won't be part of the equation.
So to recap the bleak reality for 2026, most people will pay by first draining their parents' life savings.
Yes.
Then they'll drain their own.
Right.
And finally, after financial devastation, they may qualify for Medicaid. It's a system that's failing everyone.
It's a system built on a patchwork of hope and, frankly, flawed assumptions. Now, here's a question we'd like you to think about.
Okay.
Knowing the immense gaps in the system, If our society were to redesign how we pay for long-term care from scratch, what should be the #1 priority? Protecting family wealth, ensuring quality of care for everyone, or something else entirely?